Here we are just explaining the fundamental of nursing syllabi, and this syllabi for associate degree of nursing program. We are always committed to provide the student with only the best services, and during this journey we try to give you a question bank as well, and also in our PowerPoint we try to explain everything. And that's why we have a good number of the students or nurses have trust us for their licensing exam, and particularly their licensing exam preparation. And now we will have the option to study using our own materials for next generation NCLEX exam. So it is also important that our new NCLEX question bank or our study materials include the same hallmark feature that have helped so many students or nurses to get their success, right? And also we have a 2 weeks clinical rotation, and clinically it is relevant content, our PowerPoint, our question bank, or each and everything. So here I'm going to explain a little bit. First of all, the course syllabi or content, it is say NUR 101, which is the fundamental of nursing, right? So first of all, it is important, I want to share with you, in order to become a licensed nurse in United States or Canada, it is required that the candidate must pass the NCLEX exam, right? So in this content, I'm going to explain basically what you need for NCLEX exam. This syllabi, I believe it is both for NCLEX PN and NCLEX RN. Okay. And also, we always try to involve the student active learning process. I will explain what is active learning process. So this is the semester credit hour, 7 credits and 60 hours. We have a clinical or simulation lab. When students come to the school, they will get 60-hour credits. And if you ask me, do I need any pre-requirements for 101? Definitely no. And before to start 101, it is good to finish the 102, 103, and 104. And also, Evaluation Health Academy faculty work as an instructor. So they will explain all details, okay? Because if what is our difference to other school? Because our instructors share their experience with the student, and the essential component in our exam systems, we always try to print in your mind about NCLEX PN or NCLEX RN. And they said the course description, and this course provide opportunities to develop the competence necessary to meet the needs to individual throughout the lifespan in safe, legal, and ethical manner, and using the nursing process. The student learn consent and theory basis to the art of science of nursing, right? And here, the roles of nurse, the numbered healthcare team is emphasized. The students are introduced to the consent of the patient need, safety, communication, teaching and learning, critical thinking, ethics, cultural diversity, nursing history, program philosophy of nursing, concept of gerontologists. So basically here in our NCLEX board, we always try to give you the innovative explanation, good PowerPoint, and also we give you the exam we called customized exam, or we give you some flashcard. It helped to the student basically. And here I've said the psychological safety. I mean, when initially this course introduced the psychomotor nursing skill. So when you go through this program, our every instructor will explain some fundamental skill, right? We call psychomotor nursing skill or chronological safety, and introduce along the skill need to the therapeutic intervention. So basically, in this course, you will able to understand administration of administering infection control, administration of medication like ophthalmic medication, oral medication, applying the sterile gown and closing the gloves, applying the restraint, assessment the respiration, assessment the radials or apical pulses, hand washing, measuring the vital sign like blood pressure, body temperature, also saturation of oxygen, open the gloves, or preparation of the sterile field, preparation, preventing infection, seizure precursor, surgical hand aseptic procedure. So all we include in our simulation lab. At the end of this course, students demonstrate competency of performing the basic nursing skill for individuals with the common health alterations. The clinical component of this course provide opportunities of the beginner student of nursing to learn and practice through the explanation, their active participation or demonstrating, and also care provider activity essential for the basic practice of nursing, right? And as I told you, students should participate active learning system and improve. We always try to improve the student outcome. Also, we have some visual aid supporting learning system that most of the students like Google Classroom, some videos, and also we try to give them the supporting research materials, or which is the part of the active learning process. Next here, course objectives. We try to demonstrate the competence of performance, the basic skill, utilize the foundation of knowledge and communication process, apply the foundation of knowledge of nursing process to providing nursing care for the client, utilize the critical thinking skill, utilize the teaching learning plan, right? Develop the competency necessary to meet the need of individual throughout the lifespan, utilize the technology for the client, and also demonstrate professional behavior associated with the nursing. What are the instruction goals? Right? It is cognition and performance. Cognition means comprehensive knowledge of nursing fundamental and nursing process. Apply the knowledge for nursing fundamental and nursing process in simulated and also clinical environment. Course outcome, assess the vital sign, utilize the nursing process and critical thinking skill. So you see the nursing process. So first of all, when patient come to us, we take the history taking, then we go for analysis, right? Then we go for nursing diagnosis, nursing planning, implementation, and we evaluate it, which is called nursing process. So what we learn in the school and what we do in the hospital and what we see to the patient, we try to coordinate with our basic knowledge and skill. And it is called critical thinking. So method of instruction delivery, the plan may include, we have a lecture, discussion, computer assisted learning, group and individual learning activity. So when you come to the simulation lab, student can participate actively, right? Also, we have an audio visual aid. We provide you textbooks also. Other projects may also be utilized. So supporting document and active learning system, I said, right? So it is our philosophy. Basically, we give the student innovations and development evidence-based nursing education that produce and product that build a strong critical thinking and clinical resources skill with promote the learning success. Very important. The course content here, the course is based on the book name. It's called On Potter Books or Fundamental of Nursing. St. Louis, this writer name. And also this is the book name. You can buy it for your. Now here is here instruction and student responsibility. The instruction of this course is responsible to provide information regarding expectations of the student, require assigned and activities, and so any kind of completions. And this course is designed to be interactive and therefore require the maximum participation from each student. Here, I'm going to share with you the grading scale system. So if student get in between 100 to 95, they're supposed to get A. If in between 94 to 85, you're supposed to get B. If you get 84 to 75, C. So B less than 75, basically fail. The theory component student must achieve 75% on the theory component of the course. The student are not progress to the next semester of nursing course if they do not achieve 75 average. Very important. And theory grade will calculate it, divided the student points achieved by the total point possible. And this point will include content exam, two midterm and plus marker exam. Also comprehensive final exam, some quizzes and classroom activities. So our unique active learning methodology paired very high yield and application or analysis level of question with details explanation, what every instructor supposed to do. Also the content rich rationale that we prepared the student for the complex challenge they will encounter in the modern healthcare system. And therefore, our goal is to not only prepare the student for their exam, but also to help them master in the concept that will make them a better nurses. Here we saw the following are the score that be given in the scale. First successful attempt, you're supposed to get 100%. Second successful attempt, 85, and third successful attempt, 75. Below 75, it constitute a failing grade, right? And here a list of book that you can follow. So the textbooks, material stuff. So I said this is the Potter and Hall Fundamental of Nursing 9 edition we follow. So also we have a Sender Comprehensive Review and NCLEX RN exam book, also same book for PN. Here's few about the course policies. General policy: student must abide by the Evolution Health Academy's textbooks policy, include the curriculum, right? It's called ASN, Associate Degree of Nursing, and also update version of catalog or policy they must follow. So what are our Evolution Health Academy attendance policies? The students are expected to attend and participate every class meeting. Instructor establish the specific policy related to absence of their course and communication this policy to the student through the course syllabi. Individual instructors are based upon the nature of the course determined what effect excused and unexcused absence have in determining the grade and upon the student's ability to remain enrolled in this course. Evolution Health Academy reverts the right to determine that excessive absence, right? And whether justify or not, also sufficient cause for institutional withdrawal or failing the grade. So the course attendance policies, the students are also expected to actively participate in all aspects of this course. And this includes the completions of assigned reading, homework, assignment, and test or quizzes, right? And exceptions to this policy can be made only under some circumstance or with a written excuse why you are absent. If the student has not acceptable excuse, he or she may extend her assignment. So if you missed or if you late to submit the work, what we could do? For any excuse to be acceptable, and student must provide the instructor with the original of a document from competent authorities, maybe by your doctor or healthcare provider, right? And for this purpose, the note from parents are not acceptable. SQs must specifically indicate the date that are to be excused and must be presented upon the first day that student returned to the school in person. Any kind of make-up arrangement must be made at that time, and decision or on whether or not allow the makeup exam with assignment is at the or any kind of dissertation of instructor to the evaluation health academy or without an acceptable written excuse or no makeup will be given. So it is, I want you to request when I give you this note or syllabi, if you read it, you get some rules and regulation, and I like to request you, it is good to follow. The student cannot have an excused absence from the final exam. If students are unable to take the final exam at the scheduled time and has a valid excuse, it will be up to the instructor or evaluation health academy what options will be available to the student. And this will be based on instructor's schedule as well as the time when the student is able to return to the school after his or her absence. And next, go here. The excuse for graded assigned can also be applied if the student are not present and make the assignment. If the student takes the assignment, he or she cannot ask or not to count that assignment his or her grade after the fact. The final exam is comprehensive. So all exams are closed book, no student proceed, study sheet, or any kind of note or note from class, electronic information may be used on exam, not to use. So academic dishonesty. So it is good to read before sign. If you okay, it's fine. You're welcome. So all type of activity that is considered dishonesty be reasonable standard may constitute academic misconduct. The most common form of academic dishonesty, if you do any kind of cheating, any copy or paste, any kind of plagiarism, an old instruct of academic dishonesty will result in the grade of 0 for the work involved. Here, some of the example of cheating we left, but are not limited to, right? What next? Next here, talking about the disruption of learning environment. So behavior will disrupt the teaching learning process during the class activity will not be tolerated. While a variety of behavior can disrupt it in a classroom setting, more serious examples include like abusive or any kind of threatening behavior. A student who fall to response to reasonable faculty direction regarding the classroom or behave while participating in the classroom activity may be dismissed from the class. And here some common example of disruption behavior which should be avoided, right? Like refusal, monopolying, talking, failing to respect the right or other student, also constant questions or interruption that interfere with the instructor presentations, use of electronic device, or also routinely entering the class late, leaving the early, or leaving the re-entering the class during the lecture, right? And next go some condition attribute to physical or psychological disability are not considered a legitimate excuse for disruptive behavior. Here are the policy. I like to request, read it carefully before sign, right? Like general data from this course may be used by instructor or research on improving method of learning. Grade will not be communicated by phone or email. Grade, right? And here some dress code and supplies. Students are expected to wear the school uniform when they come in school in person, any lab, any lecture, or any simulation lab class. No other alternative dress are allowed. Method of communication grade. Result of each exam will be given to the student written immediately after a test, quiz, or exam. If a student failed, so what they should do? A remediation. Students who are not meeting the course objectives requirements are expected to look for assistance of a tutor or their instructor. It is the student's responsibility to make an appointment with the course instructor for directions of grading remediation. Here I'm going to tell you the person who required the specific information regarding the services should call the student services if you need. Here I say the week, date and hour, course module, and assignment. In first week, we actually talk module 1 that include cultural awareness, and assignment include read the PDF document, what instructor is supposed to provide, read the PowerPoint, read the books and chapter, and watch the all video from Google Classroom and take the quizzes. Week 2, it is, you say, 8 hours, module 2, elimination. Read PowerPoint, PDF, books and chapter, watch the video from Google Classroom, take the quiz. And week 3, 8 hours, module 3, infection control. Most important for NCLEX board, you must get question. Every student must carefully read this chapter. We provide you some PowerPoint, books, videos, and you at the end of this, you have to sit for the quiz. Week 4, basically 7 hours, module 4, content fluid and electrolyte balance, acid-base imbalance. So, NCLEX board, due to some unknown reason, they like to ask the question from electrolyte. We can provide a wonderful note in one page, every electrolyte imbalance, sign, symptom, the key point, and NCLEX high yield. Everything as a note we will provide you. Also, acid-base balance. If you do not know acid-base balance, if you do not know food electrolyte, if you do not know infection control, it is good not to go for the board exam. right? And week 5, 8 hours, module 5, talking about the nutrition, daily requirements, deficiencies, and signs, symptoms of the disease. We provide PowerPoint, books, videos from our Google Classroom, right? So students actively participate, right? So then week 6, here, 7 hours, it is module 6, pain management. Week 7, 7 hours, module 7, talk about the safety. And next here, week 8, we're supposed to, it is 8 hours, about hygiene, sleep, and rest. And week 8 is altogether 16 hours, 7 modules, right? And now we are going to talk some modules content details, what actually discuss about. So week 1, as I told you, module 1, cultural awareness, the chapter 1. Cultural awareness, talking about the social and cultural influence in the health, illness, and caring method. Differentiate cultural, right? Different culture, cultural diversity, and component belief. Identification the major component and cultural assessment, and use the cultural assessment to identify the significant values, beliefs, and practice critical to nursing care of individual experiencing the life transitions. Demonstrate the nursing intervention that is achieved cultural or analyze the outcome of culturally, right? What patients need for the care, because some patients believe on their culture and it is not a problem. And learning activities, right? We have to follow our textbooks, Fundamental of Nursing by Potter, or you can follow the Sender Comprehensive Review books and click RN, right? Or you can use any past exam materials, any materials that can provide you or help you to pass your exam at least 75%. So week 2 include module 2, talking about the elimination. Elimination include basically urinary elimination and bowel elimination. Urinary elimination means the process of urination, identifying factors that commonly influence urinary elimination, compare and contrast abnormal alteration in urinary elimination, like stoppage, increase the frequency, excess amount, or scanty. Identify the nursing diagnosis appropriate for patients with alterations in urinary elimination, characteristics of normal and abnormal urine. Describe the nursing implications of common diagnostic test of urinary system. Also, we will discuss the nursing measure to promote the normal menstruation and reduce episode of incontinence. We will discuss the nursing measure to reduce urinary tract infection, UTI, how to reduce. Identify two modalities of renal replacement therapy, like dialysis or kidney transplant, and how to take care of them. Bowel elimination describe the rules of gastrointestinal organ in digestion and how it participate or proceed to make the feces materials to eliminate or expel out. Describe the three functions of large intestine. Explain the physiological aspect of normal defecation. Discuss the psychosocial and physiological factors that influence the elimination process. Describe the common physiological alterations. Also, the list of nursing diagnoses related to alteration in elimination. What are the alterations like diarrhea or even absolute constipation? Bowel does not move. Describe the nursing implications for common diagnostic examinations and gastrointestinal tract. What else? The list of nursing intervention that promote the normal elimination. List of nursing intervention include bowel training, also care to measure required for patients with bowel diversion. What are the learning activities in week 2? We have to, what are the materials? Fundamental of Nursing by Potter, comprehensive review by Sender, right? And passing exam, 75% at least. Week 3, module 3, basically we talk about the infection prevention and control. Like example, explain the relationship between chain and transmission of infection, right? What are the agents, host, reservoir, transmit? Give the example of prevention of infection for each element of infection chain. Identify normal defense of body against infection. Describe the events in inflammatory response. What are the cardinal signs of inflammation? And identify the patient's most risks for infection. Describe the signs and symptoms of localized infection and those of symptoms infections. Explain conditions that promote the transmission of healthcare associated infection. Explain the difference between medical and surgical asepsis. Explain rationale for standard precursor, and explain how infection control measures differ in home versus hospital. Explain the procedure for each isolation category and understand the definition of occupational exposure, and also explain post-exposure process. So it is this topic, or we will talk about this during week 3. Same as the learning materials, book, Fundamental of Nursing, comprehensive review, and passing exam at least 75%. Week 4, module 4, basically talk about the fluid and electrolyte and acid-base balance. Describe the process involved regulation of extracellular fluid volume, body fluid osmolality, and fluid distribution. Describe the process involved regulating the plasma concentration of potassium, calcium, magnesium, and phosphorus ions. Hyperkalemia, hypokalemia, hypernatremia, hyponatremia, hypercalcemia, hypocalcemia, everything we will discuss. It is included in week 4. Describe the process involved, the regulation of acid base, alkalosis, acidosis, metabolic and respiratory, all included. Describe the common fluid electrolyte and acid base imbalance. Identify the risk factors for fluid electrolyte and acid base imbalance. Interrupt the basic fluid electrolyte and acid base value, and describe the purpose and procedure for initiations and maintenance of intravenous therapy, and describe how to measure and record fluid intake and output, and also explain how to change intervention solutions and tubing and discontinue the infusion, and describe the potential complication of intravenous therapy, what to do if occur, and also describe the procedure to initiate the blood transfusion, intravenous manage of transfusion reaction. Every student must know what are the signs, symptoms of blood transfusion reaction, what are the precursor. Same as the textbooks, Fundamental of Nursing by Potter, Comprehensive Review by Senda, and passing minimum score 75%. Week 5 basically talk about the nutrition. Explain the importance of balance between energy intake and energy requirements, the end product of carbohydrate, protein, and fat. Explain the significant standard under unsaturated and polyunsaturated fat. Describe the food guidelines and discuss their value and planning of meal for good nutrition. List of kind dietary guidelines and also variance in nutritional requirements throughout the growth and development. Also measure method of nutritional assessment. Identify the 3 major nutritional problems and describe patient at the risks. Kwashiorkor, marasmus, vitamin E deficiency, every student must know. Establish the plan of care to meet nutritional needs. Also, describe the procedure for initiating and maintaining anti-feedings. Method to avoid complication and method to avoiding complication of parental nutrition. Medical nutritional therapy, also counseling and patient education in relation to the patient expectations. What else? Week 6, talking about the pain management. So discuss the common misconception about the pain, physiology of pain, what are the components of pain experience. Also, explain how physiology of pain related to selecting interventions for pain relief. Describe complication of pain, component of pain assessment, and explain how cultural factors influence the pain experiences. Describe the guidelines for selecting and individualizing pain intervention. Explain various pharmacological approach and treating the pain, and describe applications for use of no pharmacological pain interventions. What else? And discuss the nursing implications for administering the analgesics for pain management, identify barrier of effective pain management, right? Identify the barrier. Like I have a peptic ulcer disease, and so NSAID is not safe for me. So we have to know what are the concerns about this. And learning activities like Sender book, Fundamental of Nursing by Porter, and Sender comprehensive review for NCLEX RN, right? And passing of 75%. Week 7, module 7, talk about the safety. Discuss the important standard for public reporting of patient safety, environmental hazard identifications, method of reduce the physical activities that end transmission of pathogen, discuss the specific risks to safety related to the development age, identify the factors, assess when patient is in restraint. Describe the 4 categories of safety risks in healthcare agencies. Describe assessment activities and design to identify the pattern, physical, psychosocial, and cognitive status is the patient to their safety. Identify relevant nursing diagnosis associated with the risks of safety and describe nursing interventions specific to patients' age for reducing risks of fall, how to prevent the fall, or fire, poisoning, and electrical hazard. And define the knowledge, skill, and also aptitude necessary to promote the safety in healthcare setting. It is included in module 7 and talk about the safety measure. Week 8 basically talk about the hygiene, sleep, and rest. So here it is include hygiene. What are the factors that influence personal hygiene practice? The role that critical thinking play to providing the hygiene, condition that place patients at the risk for impaired the skin integrity. So this is actually keyword. You have to know the information related to this keyword. And this keyword important for NCLEX board exam. Discuss the factor that influence the condition of the nail and feet. Explain the importance of foot care for the patient with diabetes. Discuss the condition that place the patient at the risk for impaired the oral mucous membrane. Also the list of common hair and scalp problem that related to intervention. Describe how hygiene care for older adult differ from the younger patient. What else? Next, discuss the different approach used in maintain the patient comfort, safety during hygiene care, and also adapt the hygiene care for patient, right, who is cognitively impaired, like Alzheimer or Parkinson disease. Sleep and rest, like example, the effect that 24-hour sleep-wake cycle has a biological function. Mechanism that regulate the sleep, the stage of normal sleep cycle. Also, what are the function of sleep? Compare and contrast sleep requirements of different age group. Identify the factors that commonly promote and disrupt the sleep. Discuss the characteristics of common sleep disorder. Identify the nursing diagnosis approach for patients with sleep alterations. Identify the nursing interventions designed to promote normal sleep cycle for patients for all ages. Describe the way to eliminate the sleep therapies, right? What are the resources or learning activities? We follow Fundamental of Nursing, 9 edition by Potter, chapter 40 and 43, right? And also conduct a comprehensive assignment of the patient's total hygiene needs. Since it also successfully perform hygiene procedures, so when you come to the school, our clinical instructor will show you how to do this. And pass exam minimum 75%. Here showing some practical or simulation lab, clinical or lab functions, 60 hours. So here we include diagnostic test, laboratory values, medication and IV calculation, perioperative care, and the skill. For learning activities include we have to read chapter by chapter and read the PowerPoint in our Google Classroom. Also, we advise to watch the videos. In simulation lab, when students come, what they do, they will be busy how to applying the restraint, type of restraint, order for the restraint, indication of the restraint, scissor precursor, hand hygiene, preparation of the sterile field, how to wear surgical, how to use the hand aseptic procedure, applying the sterile ground, performing closing gloves and open gloves, measure blood temperature, assessment the radial and apical pulses, assessment respiratory rate, measure oxygen saturation. We use the pulse oximetry. And next, here we go. So next here, measure the blood pressure manually or using the machine. Admin the oral medication, admin ophthalmic medication using the metered dose or dye powder inhaler. So when students come to simulation lab or when students go to the clinic, we will show it. So every clinical instructor will show you and students actively participate. Preparing injections, administering injections, administering medications by intravenous bolus, administering IV medication, also intravenous infusion set, mini infusion pump, right? We will show you how to use, what are the identification, how to calculate the drops. Measuring the perineal care, performing nail and foot care, oral hygiene, perform mouth care for unconscious or debilitated patients, right? How to make bed or occupied bed. So it is the keyword, my friend. Aspiration precursor, insert the small bore nasoenteric tube for enteral feeding. So GIT does not work or need to rest after surgery. So we use the parenteral nutrition. Admin enteral feeding via nasoenteric gastrostomy or jejunostomy. Blood glucose monitoring, suctioning, care of artificial airway, right? Care of patient and chest tubes. So it is the keynote or keyword every student must know, because some students do not know what they should know, right? Applying the nasal cannula and oxygen masks using oxygen equipment and collecting the mid stream urine for specimen. Insertion the strength on wood row catheter, indwelling catheter care, closed catheter irrigation, also initiating intravenous therapy, regulating intravenous flow rate, maintaining intravenous system, and changing peripheral intravenous dressing, administering a cleaning enema, insertion and maintaining nasogastric tube for gastric decompensation. Also, using ostomy or moving and positioning the patients in bed. How to do this? Using safe and effective transfusion techniques. What else? Also measuring the risk factor for blood pressure ulcer development. You have to avoid. Treating the pressure ulcer, applying the dry and moist dressing. Also implementations of negative pressure wound therapy. Performing wound irrigation, applying abdominal binder, and applying the elastic binder. So we will show you how to do this, and it is called your skill developed. Here showing what are the resources for theory and lab practice. Here we provide some related videos from YouTube. YouTube is not a tools for NCLEX board, but YouTube's videos help you to see what are the procedure to demonstrate it. So it helps to make the materials very clear. So it is like safety, some important link, infection control, important link, right? Pain management, hygiene, fluid and electrolyte, nutrition, acid base, lab below, IV therapy, medication, diagnostic test, perioperative skill. So every student must get the syllabi and course curriculum. They have this link. You can click the link and watch the videos. It helps to step up your knowledge. And also we have a PDF book. If you request, we will send you the book by email. So here we can say acknowledgement and syllabi. So you read it. It is make sure you can understand each and every sentence and line to line. Then you can write your name here. I received and understand the syllabi containing the policies and requirements for the fundamental of nursing, subject code NU1 101. I have reviewed the syllabi and understand the objectives of these courses. I understand how my performance will be evaluated and how my final grade will be determined. So if you are agree, you can sign here, put the date, and you can email to school, right? So before to say goodbye, I want to tell you, since we started use these materials, what we use for NCLEX in our practical nursing program or associate nursing program, we have seen to dramatical improvement in our NCLEX passing rate among our students, particularly last 3 years. We use our own materials in the classroom and assign the homework. So our student that have recently taken and passed the NCLEX, they said it was spot on and most helpful resources for their exam and their exam preparation. So we love all of this product. Basically, we use for our student and are we excited to continue and encouraging them to use our materials and use it how to get this license. Thank you so much.